Hi, I'm Dr. Senthamizhan from Athreya Hospital. I'll be discussing about a topic known as prostate and the surgery known as prostatectomy. What is prostate? Prostate is a gland which is located in the lower part of urethra, which is come under the urogenital system. What is the main function of the prostate? Prostate is a gland which will help in the ejaculation of the sperm when ejaculation is happening. Why? What is known as prostate? Why the prostate surgery has to be done? Prostate surgery is done commonly for three conditions. First thing is BPH, which is benign prostate hypertrophy or hyperplasia. What is BPH? In the old age patients, when the hormonal secretion difference is happening, this prostate gland will be increasing in size, which will be blocking the urinary pathway, which will give the symptom like a frequency of maturation, pain during maturation, or improper voiding or incontinence. This kind of symptoms will happen in BPH patient. It is always and almost happen in the old age people. It's occurring in the very young age is very less, and it is very common to see those things. Second thing will be prostate cancer. The prostate cancer are most commonly seen in the old age people. Third thing is chronic prostatitis. Prostatitis is nothing but an infection which is happening in the prostate. If chronic means even though after proper managing with the antibiotic, if the infection is not subsiding or the recurrence of infection is happening, in this kind of condition, prostatectomy is being done. The surgery for prostate is done to two things as of now. One is stress, the other thing is laser assisted. Okay, that means robotic assisted. A part of your gland will be shaved off, and post surgically you will be keep on proper regular oral medication, which will reduce in the recurrence rate of the prostate, which can be followed up with proper PSA monitoring and your urine routine and urine culture, and probably in most of the patient ultrasound also is needed to check whether the size is remaining the same or post-voidal or the pre-voidal urine is increasing or not. The patient thinking about the prostate, most of the patient knows that it is in the sexual tract or the urinary passage tract. The major factor which adherent the thinking of the patient is whether it is going to adherent my urinary passage. The most common complication post surgery is urinary incontinence. It is happening because when the prostate is getting shaved off, there is an area known as ureteric internal sphincter. If suppose it is going to injure the continence can happen, but you patient need not worried about it. Post surgery, as a treating doctor will be knowing how to manage it with medication also. So patient need not worried about this complication. And second complication is patient is thinking what will happen to my sexual arousal center. Even though it is located as a glandular organ which is helping in sperm ejaculation, the libido post surgery is not going to reduce abruptly. Third thing is patient will be having whether my bowel or the bladder, urinary bladder is going to get injured. Since arrival of the new technology, very minimal invasive method is going to be done for the surgery, and it's going to be scarless surgery. The surgery is going to be carried out in the next natural orifice where the gland will be shaved off carefully with the cautery, or doing a laser surgery it can be done. So patient need not worried about post surgery complication, and patient has to be counseled properly before the surgery, and before surgery pre-operative counseling or pre-surgical counseling for the patient regarding what surgery is and why the patient is going through the surgery should be explained properly. Pre-operatively, patient should undergo proper PSA monitoring. PSA means prostatic specific antigen, which will be elevated in cancerous stages, and even in infection it will be elevated. So PSA has to be monitored, and pre-surgical proper ultrasound and proper scanning has to be done, because the most of the common complaint which the patient will arise before a prostomegaly is informing the patient is not able to void completely and increased frequency. So pre-surgically ultrasound with pre and post-voidal has to be calculated, and patient has to be thoroughly examined with the diagram, and this is what patient is suffering from, and this is the surgery what the patient is going to be addressed with the surgery. And post surgically patient should be evaluated regular interval so that the recurrence of the condition is very less. For regarding follow-up, whatever surgery as patient has undergone, follow-up play a major role in the recovery from the disease, because post surgery patient physical part of has been removed. So patient should understand a proper follow-up post surgery is always going to recovery phase going to be very smooth. What and all follow-up, what and all things patient has to do during follow-up, a proper regular USG scan along with the urine routine to just to check whether the urine flow is normal or any kind of minor urine infection is there. Third thing is proper PSA monitoring. PSA monitoring indicate whether the surgery has gone in smooth way and also give us an idea whether the condition is recurring or the treated condition like cancer is recurring, or the recurrence rate if it in the initial stage can be avoided or not. So proper follow up with a regular blood investigation along with the simple ultrasound scan will give the recovery space so smooth, and it will always help to avoid or detect the recurrence in very early stage so that the treatment can be done smooth and in a prospective way.